Hello viewers, welcome back to my YouTube channel. My name is Deborah Kiboma, and today we are going to talk about the role of insulin in the treatment of diabetes. Welcome back, Dr. Bharath.
Hello Deborah, how are you doing?
I'm doing fine, thank you.
Hello viewers. Yes, we'll be talking about the role of insulin in the treatment of diabetes.
Yeah.
There are so many myths, especially in our African people. They think that if I start insulin, that is the last stage of diabetes. That is the generally commonly prevalent opinion among the masses.
Yes.
In fact, recently I had a patient. He had come with a situation in which I had to give him insulin.
Okay.
But 2 days he got the treatment. Third day, not even the third day. Second day evening, somebody put poison in his mind, saying that this doctor is treating you unnecessarily with insulin, and he ran away.
Maybe I don't know what the meaning of the word insulin. You could explain.
Insulin is a drug which
Okay.
has to be injected.
Okay.
Okay, it is an injection which the patient takes every day. Sometimes 2 times a day, sometimes 3 times a day, sometimes 4 times a day.
Okay.
It depends upon the necessities of the patient. We have to tailor make the treatment. Okay, so because it is an injection, people are afraid of taking it. Okay, and this is not only here in Kenya. Worldwide, many people have misconceptions about insulin. Okay, before we understand what is insulin, what are the types of insulin, we have to see first of all how diabetes comes. Okay, diabetes disease comes because of two factors. When you discuss the pathophysiology of diabetes, there are two things which can happen. Either underproduction of insulin or underutilization, which means the insulin which is produced is has become resistant, which means it is not working. Okay, so
the insulin is not working.
Insulin is a normal hormone which is required for the normal metabolism. Okay, when we eat our food can be broadly categorized into carbohydrates, chemically. Okay, when we analyze the chemical nature of the food, our food contains carbohydrates, proteins, and fat. Carbohydrates should be around 55 to 70%. Okay, depending upon the diets of various people. Proteins are around 20 to 30%, again depending upon the diets of the people. And fats are 5 to 10% in our diet. Okay, this carbohydrate is the most important thing because this is the one which actually gives us energy. Okay, and all the carbohydrates that we consume, okay, all the carbohydrates, that means either your ugali, your rice, or maize, whatever you eat, everything has carbohydrates. And these carbohydrates, when they are digested, ultimately they become glucose. Okay, this glucose is the one which gives us energy. Okay, this glucose has to enter inside the cells. Okay, to facilitate this one, there is something called sodium glucose co-transporters. Okay, these are certain channels which carry the glucose which is present in the blood into the cell. Okay, if the glucose doesn't go inside the cell, it is not useful. Okay, so these glucose transporters, they transport the glucose inside the cell, and to facilitate that one, insulin works. Okay, once the glucose is inside the cell, it will go into cytoplasm where it is digested. Okay, and from there it goes into mitochondria where the electrons transport chain converts into ATP. Okay, ATP is also known as energy currency. The full form of ATP is adenosine triphosphate. It's an energy molecule which gives energy to all the cells in the body. Okay, so for the glucose to enter inside the cells, the insulin is like a key. For example, you have a door. You want to open the door. What you have to do? You have to unlock it. So you unlock it using a key.
Yes.
Insulin is like a key.
Okay.
Okay, and it is produced by pancreas. Pancreas is an organ which is present at this area.
Yeah.
Okay,
Yeah.
and it looks like a what you call like a fish. Okay, it's in the form of a fish.
Yes.
Okay,
Yes.
and it is when you touch it, it is like it is wet. It has a consistency of a wet cloth.
Okay.
Just like from a wet cloth, water drips, insulin drips from this pancreas.
Okay.
Okay, and it goes into the blood.
Yes.
Okay, and it goes to various parts in the body through blood, and it acts on each cell in the body. Every cell in the body receives insulin, and this insulin makes the glucose go inside the cell. So what happens in diabetics is either this insulin is not produced in enough quantity. That means the pancreas, which looks like a wet cloth, either it has dried up, or whatever the insulin that is produced, it is not acting on the cells. That means the lock is changed. Okay.
Yes.
So this is what happens. So what is lacking in diabetes? Insulin.
Yeah.
So treatment, give the same.
It's true.
Okay. All the other drugs which we use in diabetes, like tablets, most of them, they work by either producing more insulin, that is sulfonylureas are a class of drugs which makes the pancreas to produce more insulin. But the pancreas has already dried up. It is like squeezing a already semi-dried cloth.
Yeah.
So sulfonylureas are the drugs which do that.
Yes.
And most of the people use this sulfonylurea by name no-gluc. It comes as no-gluc. Okay, but the problem with the sulfonylureas is that they will increase the insulin resistance because the pancreas is already dried up.
Yeah.
It is not producing enough insulin. So we cause what a phenomenon known as beta cell burnout. Okay, beta cells of Langerhans are the cells which actually produce insulin in the pancreas, and these cells gets burned out because they are overstressed.
Yes.
Because they are already few in number, and the few in number is trying to produce more insulin, and will cause more and more insulin resistance as the age of the patient progresses.
Yeah.
And the other drugs act by various mechanisms in which the body's insulin resistance is modified so that less insulin can act on more cells. Okay. In previous days, the dictum was that when all these strategies fail, that's when you start insulin.
Yeah.
But that is not true. Okay.
I think more people are not informed about.
Yes, people are
insulin.
not. Yes.
So they have fake knowledge about.
Yes.
insulin.
Yes. Especially less educated people and older generation doctors also.
Yeah.
Sometimes they tend to tell the patients that insulin is the last stage. It is not like that. In our previous discussion, we said the diabetes disease has no defined stages. There are no clear-cut stages. It's not like cancer, like there is stage 1, stage 2, stage 3, stage 4. It is not like that.
Yeah.
Okay. And one more thing about insulin is this is a recent finding. Diabetes can regress. Regress means that the disease can be corrected. Disease can go back.
It can start again, you mean?
You can go back to normal.
Okay.
Okay, by lifestyle modifications, by lifestyle interventions, you can become free of diabetes.
Yeah.
That is the latest knowledge. So, in a disease where there are no preset stages, it is very difficult to say that this is last stage or this is first stage.
Yeah.
So, it depends upon the clinical condition of the patient. For example, if you take me, I myself am a diabetic. Okay, right now my HbA1c level is 5.6. HbA1c is the definition for diabetes. Okay.
Yes.
Normal values are 5.8 to 6.5 is pre-diabetes. Anything above 6.5 we call diabetes mellitus. And for people with diabetic people, we tend to target less than 7 values. Okay, that is the optimum value for diabetics. And if the value goes above 8, that is an indication for insulin therapy, but not in everyone. There are certain conditions.
Yeah.
Okay, so there is a wealth of knowledge which one has to learn before treating diabetes. The problem is everybody treats diabetes nowadays.
Yes.
General practitioners treat diabetes, internal medicine specialists treat diabetes, endocrinologists treat diabetes. But who is the right person to treat what? A simple diabetes which can be corrected by tablets can be treated by general practitioners or non-specialists. Okay, But a diabetes, a HbA1c value of more than 8, and a person having maximum, more number of complications, they are to be treated by a specialist who is specialized in diabetes.
Yeah.
Okay. So this is a very complex thing, but unfortunately people don't see. I was telling you about a patient who ran away from me. I was trying to explain to him on this whiteboard itself. He was not even ready to listen to me.
The problem is that our people are not informative about the disease, and that's why we are here. All the questions that you've been pressing on, they are here, and you'll get answered. Are there side effects?
Insulin, the only side effect of insulin is most of the time hypoglycemia. Hypoglycemia means falling of blood sugar, rapid falling of blood sugar actually. This rapid falling of blood sugar is actually causes the symptoms. Many a times people who are taking the insulin for the first time, they experience symptoms like sweating, excessive sweating, palpitations, weakness, sometimes blackouts.
Yeah.
Okay, but these things happen. But the definition of hypoglycemia is less than 90 milligrams per deciliter or less than 6 millimoles per deciliter values. Okay, but sometimes people may not have sugar value less than that. But what happens is these people are used to high sugars, and rapid decrease in blood sugar also causes symptoms in some people. So, and people are afraid of that. Some sensitive people are afraid of that. That is the only thing. But if the patient is counseled nicely and if the insulin is used judiciously, then hypoglycemic occurrences will be very, very less.
Okay.
And the second effect of insulin usage is weight gain. Okay. Some people do gain weight with insulin because insulin is an anabolic hormone, which means body building hormone. So some people do experience weight gain over a period of time.
Can someone take the insulin without using a syringe?
No, right now it is not possible because most of the insulin formulations are available as either vials or pens. Okay, but taking through a pen is very easy and it is also pain free. It has very fine needle. You will not know that you are taking injection. Okay, when an insulin is given through pen, but it can be painful with regular insulin syringes.
Okay. Yeah. There's this question that I wrote down, that what else can a patient do to control his or her blood levels, blood glucose levels?
Yes, lifestyle modification, that is the most important. Okay, doing exercise daily, living a stress-free life, and also living a contentful life. These are the key things to controlling diabetes. Okay, even though you are doing exercise, even though you are using medicines regularly, if you are not at peace with yourself and you are stressed out, sugar will not be controlled.
And does this insulin lower blood levels?
Yeah, the insulin is given for efficiently lowering the blood sugar
The
levels.
main reason for the insulin.
Yeah, the main result of insulin is regulating the blood sugar levels to optimum levels, but it has to be judiciously prescribed. I always suggest for the patients to go to a specialist if he or her requires insulin therapy.
Okay.
Yeah. And one more thing you have to understand is that insulin in olden days, it was produced from either bovine or porcine sources. That means extracted from the pigs or from the oxen, cows and oxen. Okay, but nowadays it is produced through recombinant DNA technology by DNA splicing methods. DNA splicing is an advanced molecular biology technology in which we insert the genes of one organism into some small bacteria or another organism. Thereby we can produce the substances that are required for us. And it is done on an industrial scale now. So there are no bovine or porcine source of insulin anymore in the market. Now there is only recombinant insulin and that recombinant insulin also is made efficient. There are new types of insulins nowadays which are called insulin analogs, which work more than our insulin which is produced in the body. This is an insulin which is synthetic, which is synthesized by manipulation of certain amino acids in the insulin chain. And this particular insulin, these insulin analogs, they work for either more time or they work for ultra short time, so as to suit the needs of the patient.
Okay.
Yeah.
Before we finish the program, is there something that you can tell people about the insulin?
Don't worry if your doctor prescribes insulin. It is not like olden days where people who are on insulin they have to continue for lifelong.
Okay.
Of course, for type 1 diabetes, which happens in the childhood, there may not be other medicine other than insulin.
Yeah.
But type 2 diabetes, which is more prevalent, especially in the adults and middle age groups, insulin treatment doesn't mean that you have to take insulin for lifelong. Insulin treatment can be given for 3 months, after that, it can be stopped if the optimum control of blood sugars is achieved.
Okay.
I myself is an example. In the month of January, I did some stupid things.
Okay.
My lifestyle was bad, and my HbA1c levels got up to 12, which is very, very, very bad.
Yeah.
It's actually, I'm ashamed to say that being a diabetologist, I had those values. But then again, I started controlling my lifestyle. Okay, I started living a stress-free life. I stopped all bad habits. I stopped all bad kinds of foods that I had eaten at that time.
Yeah.
So now, and I also used insulin. Okay, I used insulin for 2 months, and my sugar got controlled. Then I stopped insulin. Right now, I'm not taking insulin, and my blood sugar is perfectly controlled. It's actually 5.6.
Wow.
My director was like, he was not believing in me. Actually, I told him, no need to believe in my own result. You can test my patients also. There are many patients of mine who are living near normal lives with near normal HbA1c levels. And what we have done essentially is we regressed diabetes, albeit with treatment, but I reduced number of medicines for them. People who used to use 8 medicines at one point of time, now they are using only 2 medicines. Sometimes it is even possible, for example, if I can keep my lifestyle like that, I can be free of drugs.
Yeah, it's true.
So diabetes can be regressed. So don't think that giving insulin is like a death warrant or what you call life imprisonment kind of a situation. Insulin need not be taken lifelong, especially in type 2 diabetes. It is possible to stop it given you follow a certain set of rules. Okay, you live healthy lifestyle, eat healthy, do exercise, live stress-free life, then insulin can be stopped and taken back to tablets. And it is also possible, because diabetes is regressible, we can even stop uh, all the drugs for diabetes treatment, and it is possible to make you normal, but there are always caveats.
Okay.
Yeah.
Thank you so much for today. Continue subscribing if you're a returning subscriber. Thank you so much. Continue watching my YouTube videos. Let's meet next time.
Like, share, subscribe.
Thank you.